Hello, I'm Megan Mesa, and I'm a nurse with the Division of Colorectal and Pelvic Reconstruction at Children's National Hospital. I'm here today to review with you how to care for your child following their Malone surgery. Before performing any medical care, always check with our team or your child's pediatrician for safety. It is normal for the Malone site at the belly button to drain mucus from the colon as it heals. It is important to keep the site as clean as possible so that the mucus doesn't dry up and create a scab at the site. For this reason, your child's Malone site will need to be cleaned and cared for each day. The goal of caring for your child's Malone site after surgery is to keep the site clean and keep your child from getting an infection. You will need soap and water, gauze or clean washcloths, Tegaderm, skin tape or a bandage supplied to you by our surgical care team in the hospital, tweezers, and small scissors also provided to you by our surgical team. Gather your supplies together so you will have everything in one place. Many families do this in the bathroom when preparing for their child's bedtime every night. Mix a bowl of warm, soapy water. Dip your washcloth or gauze into the bowl of warm, soapy water. Gently wash around the belly button. Be sure to remove any scabs, mucus, or gunk that you see on the skin. It's important to get all of that. If anything is hard to remove and doesn't wipe away easily, place a warm, wet washcloth or gauze on the site for 10 to 15 minutes to loosen it up, and then wipe it clean with a Q-tip, gauze, or washcloth. Do not put any lotions or creams on the Malone site. If your child's skin is bothered by the Tegaderm or tape that is holding the Malone catheter in place, you can remove it and move it to a different area on your child's belly or stomach area. Our surgical team will also provide you with something called paper tape. That is softer on the child's skin. This tape doesn't stick as tightly to the skin as the Tegaderm does though. So if your child's skin isn't bothered by the Tegaderm, use it instead of the paper tape. If you have any concerns about the Malone site, such as redness, swelling, pus, or junky drainage, or any other signs of infection, please send a picture to our colorectal nurse email and we will help you. Sometimes we will teach you how to cut the stitch wrapped around the catheter with the scissors we provided to you in the hospital. Only do this if you have called or emailed our team and our medical team asks you to. If we do, you will softly or gently use the tweezers to lift the stitch off the skin. Take the scissors and cut the stitch, being careful not to cut the catheter tubing or your child's skin. Use the tweezers to gently loosen and unwind the stitch from the tubing and remove the stitch completely. If you notice pale discharge coming from the stitch site, place a wet, warm washcloth on the area for 10 to 15 minutes to help the area drain. Now, celebrate with your child. You are both doing a great job caring for their body. Your child can take baths in the bathtub 1 week after you come home from the hospital. It is okay for your child to swim after 2 weeks in an ocean or pool. Your child should not play rough, lift heavy objects, or do contact sports for 2 weeks. Please call or email our medical team if you experience any of the following. Your child has a fever of 101 degrees Fahrenheit or higher, pain or redness at the Malone site, or there is yellow or green liquid or drainage coming from the site. If the site edges are pooling open. If the catheter comes out of your child. If your child is vomiting and is unable to eat or drink liquids. If you want more information, please visit the Colorectal Program's website. We have multiple videos and printed resources to help you care for your child. And don't forget, always check with your child's pediatrician or our team when caring for your child's medical needs.